Today we'll be talking about episiotomy. Episiotomy is a medical procedure that's been both practiced and debated. It's a topic that can raise questions and concerns. And in today's discussion, we will explore what an episiotomy is, why it's sometimes performed, and possible ways you can prevent it. Episiotomy is a surgical incision made during childbirth in the perineum, which is the area between the vaginal opening and the anus. This procedure is sometimes performed to widen the opening to facilitate the delivery of the baby's head. And it's made during the final stages of labor, just before the baby is about to be born. It's used to be considered as a normal procedure in the past, but recently its usage has declined due to concerns about potential risks and complications. One of the main reasons for performing an episiotomy is facilitating delivery. So an episiotomy is intended to create more space for the baby's head during to pass through the vaginal opening, especially in cases where there might be concerns about the baby's or the mother's well-being. I remember when I was giving birth and my baby was almost there, and my midwife said, "You're holding it too long, or holding it too long," and then I got another wave of urge to push, and then my baby was born. But I think now in retrospect that if his head had not come out at that time, she could have made an incision in order to prevent any complications with his head being stuck for too long. Or it could be also done to prevent uncontrolled tears. In some cases, your midwife or obstetrician may opt to perform an episiotomy to prevent uncontrolled tearing of the vaginal tissue during delivery. Now, I have read on the internet that controlled incisions are thought to be easier to heal and may lead to less severe tears. However, I clearly remember my midwife saying the opposite. So both might be true depending on circumstances. Although I never had an episiotomy, I had tears, and it's not the most pleasant thing in the world, and it takes time to heal. And recovery from an episiotomy obviously can take time, and it's important to follow postpartum care instructions to kind of promote healing, such as keeping the area clean by washing with lukewarm water after going to bathroom, and try not to carry heavy things, take care of yourself. And you might also want to know that you might not be able to sit for a while because it might stretch the area where you have stitches, so you might want to be careful with that. And you might also find going to bathroom unpleasant because pushing also stretches the area. It will eventually heal, but it will require some time, patience, and good care. Now, let's talk about prevention. What might help to prevent an incision or a tear? While it's not always possible to prevent an episiotomy during childbirth, there are steps that you can take to promote perineal health and potentially reduce the likelihood of needing an episiotomy. One of the most common advices is doing regular prenatal exercises to strengthen the pelvic floor muscles and to increase the flexibility in the perineal area, like yoga or any other exercises that specifically target the pelvic floor. I never had those, so maybe that is why I had tears. And also, please make sure to consult with your doctor first before you engage in any exercises, because you never know whether it is advised for your specific situation to do such exercises, especially during the later stages of pregnancy. Another suggestion is perineal massage, and this one I heard from a lot of women and they stand by it. So starting around 34th weeks of pregnancy till delivery, it's basically gently massaging the perineal area with natural oils to help increase the elasticity of the tissue. This might reduce the risk of tearing or needing an episiotomy. But before you do anything, again, consult with your doctor when to start, whether you are allowed at all to do such a massage. Maybe you are having some complications and it might not be desired to do anything like that. And ask your doctor what oils are best for you, because you might have allergies that you don't know about. All right. Another one is staying hydrated and nourished. Proper hydration and well-balanced diet can help keep your skin and tissues healthy and resilient. Also, prenatal classes, like consider attending childbirth education classes that emphasize relaxation techniques and breathing exercises and optimal positions for labor to help reduce stress and tension in the perineal area. And talk to your doctor about water birth, because the warm water can help relax the perineal muscles. Labor positions could also be important. During labor, try with your midwife different positions that can help open up the pelvis, such as like squatting and kneeling or hands and knees positions. These positions might reduce pressure on the perineum. And think about relaxation techniques as well. You might want to practice such relaxation techniques, breathing exercises and mindfulness to help reduce tension and stress overall during labor, which can indirectly contribute to perineal health. And if you have an option to choose your midwife and or gynecologist, try to choose someone who is open to discussing your birth preferences, who is known for maybe practicing evidence-based, patient-centered care, and someone who is willing to discuss your desire to avoid unnecessary interventions. And also remember that labor can be unpredictable, and the ultimate goal is a safe and healthy delivery for both you and your baby. While these tips might help reduce the risk of needing an episiotomy, it's important to stay open to adjustments based on circumstances during labor and delivery, and listen to the recommendations of your healthcare provider. And most importantly, consult with your doctor before you decide doing anything. Keep in mind that every pregnancy and childbirth is unique, so it's essential to discuss your specific situation, your concerns with your doctor. All right, that is it for today, and see you all next time.